Good afternoon, ladies and gentlemen, and welcome to our press conference. The press conference today will look back and ahead to the informal meeting of the EU health ministers here in Tallinn today and tomorrow. And to do that, we have with us here today Jevgeni Ossinovski, the Estonian Minister for Health and Labour, and Vytenis Andriukaitis, the Commissioner for Health and Food Safety. Minister, the floor is yours.
Good afternoon, or evening, whatever it is. Happy to welcome Commissioner Andriukaitis and the health ministers here in Tallinn for 2 days of discussions on important health topics for Europe and our member states. And we'll shortly guide you through those topics. Firstly, today we're talking about the future of e-health here in Europe. The digital single market and the free movement of data is the top priority of the Estonian presidency, horizontally through sectors. And of course, in healthcare, that means better use of health data and implementation of available technologies for the benefits of our patients across Europe. Our goal is to help speed up the data-driven innovation in healthcare, and we know that large amounts of health data are produced daily, both by the healthcare system, but also by the patients themselves. But it's mostly underused for our common benefit as it is now. And we need to therefore find ways to overcome the barriers in data sharing between and also within member states so that we could use this data for both individual and collective benefit. One of the concrete issues that we need to discuss is the implementation of the General Data Protection Regulation that will enter into force in May 2018. And here a coordinated approach to this will help us prevent unnecessary obstructions for the free movement of data. We know also that trust in e-services differs greatly across the EU, and the concerns for privacy and the security of health data must be acknowledged and must be taken seriously. Of course, that does not mean that we shouldn't move forward with e-health because there are concerns with privacy. Rather, we in Estonia have shown, and I think it's some other countries have shown, that in fact with proper concrete measures for data protection, privacy can be increased, not decreased with digitalization. This means that people should have the right to determine, firstly, who will have access to personal health information, secondly, for what purpose this is done, and thirdly, under what circumstances. Our task, of course, is to balance the risks and opportunities and to provide the tools and means that will help people share their health data in a secure and convenient manner. The aim of our presidency for the next half a year is to reach an agreement on specific joint project initiatives to be implemented and funded both by the member states and the European Commission. We also aim to lead the Council to conclusions in December to set the agenda to advance the e-health in Europe in the coming years. And to facilitate our discussions further, after today and tomorrow, a high-level e-health conference will take place here in Tallinn in October, and you're all very welcome to that. Secondly, tomorrow we will be discussing alcohol policy, focusing mainly on the EU-wide aspects of it. Harmful use of alcohol, of course, is a serious health issue as well as a remarkable economic burden for the European Union. A lot can be done at national level, of course, we know that, but we need to recognize that some topics and issues need to be addressed much more efficiently in cooperation. Above all, I'm looking forward to an open and honest discussion to learn about the challenges that member states are facing so that we could identify the issues where the EU-level solutions could and have to be achieved. The Estonian presidency has proposed to focus the discussions on especially the EU-wide issues, which often may impact the effectiveness of national measures or prohibit nation states to legislate in the interests of public health. For instance, we'll be talking about marketing and labeling of alcohol. The ministers will have a chance to express their views on the recent progress that has been made in alcohol policy at the EU level, and also about their concerns and expectations for the future. Again, these issues will be discussed in more detail at a conference in Tallinn also at the end of October. And thirdly, tomorrow we'll reflect on the Commission's proposal for the new action plan for fighting the spread of antimicrobial resistance, the AMR, in Europe. The spread of resistant bacteria has been globally acknowledged as one of the biggest threats to human health, and we need to act now. The new One Health action plan will set the agenda to fight these threats in Europe and will help us take the necessary measures to preserve the effectiveness of antibiotics also for the future. During our presidency, we plan to start discussions on the new AMR action plan, its implementation in the EU and in the member states, and on the evidence-informed policy making on the AMR. For this, we have proposed a high-level meeting in Brussels on the 23rd of November. The outcome of the discussions will be presented at the EPSCO meeting of ministers on the 8th of December, and this will also be a good input for the next presidency to draw up council conclusions on that. An important part of the prevention of the AMR lays within the veterinary medicine package that is currently under discussion, and we are aiming to finish the discussions on the package in the council and start the negotiations with the Parliament. Thank you.
Commissioner, please.
Thank you. First of all, I would like to thank the Estonian Presidency, in particular my like-minded friend and colleague, Minister Jevgeni, Ossinovski, for choosing to focus on several very challenging issues facing the European Union and member states that we have been working on together. I would like just to mention a few points that are on the agenda this time. Firstly, we discussed digital health and care. I am delighted to have e-health on the agenda. It's very, very important for all of us. We can all agree it doesn't come as a surprise as Estonians are world-famous digital pioneers. Welcome. Therefore, it is great to see the recognition of the digital technologies and their potential for strengthening our health and care systems in a cost-effective way. The midterm review of the digital single market strategy presented in May has encouraged us to speed up and intensify our e-health efforts. That's what we are doing. We are preparing a communication on health and care, which will outline actions to support the member states in their effort to introduce more digital solutions in this area. Today, we have launched a public consultation to this end, and I invite everyone concerned to participate. This will run until 12th of October. The communication will focus on three main pillars. Pillar one is how to secure access to electronic health records and the possibility of sharing this information across borders anywhere within the EU. The second pillar would focus on supporting data infrastructures, which would facilitate the sharing and connecting of data for advanced research of our personalized health and care. While the third pillar would focus on empowering our citizens and fostering personal-centered care. The potential benefits of applying digital tools and technology to our health and care systems are promising, but we need to move forward and, of course, to see how to improve our capacities. This is why I will continue to support such innovative measures that will help to keep our health and care systems relevant, cost-effective, transparent, and user-friendly. I was glad to see and feel a lot of support in the room, and I am sure that we will continue to the discussion in the same good spirit after this press conference. I'm also encouraging ministers to support further politically, financially, the European reference networks, which we have launched recently. We need greater efforts to ensure that these centers deliver benefits for citizens. Tomorrow we will discuss the issue of alcohol abuse and harm that it causes. Colleagues, Europe is still the world's biggest alcohol drinker. This needs to change. To reduce overuse of alcohol in the EU, what we need in this case to encourage all parliaments, all member states, all governments, all NGOs, all sectors and societies to act to reduce the use of alcohol. Of course, when we're speaking about abuse of alcohol, of course, it's a big responsibility of health ministers. When we are speaking about harm of alcohol, of course, we know very well ministers of justice must be involved. To reduce alcohol abuse and the harm it causes, we need to work together across all policies, using all tools to reach our objective. A 10% reduction of alcohol-related harm as foreseen in the WHO Global Action Plan. All member states are members of WHO. This obligation is up to us to implement. For example, regulating marketing and advertising, in particular to reduce children's exposure to alcohol advertising, and using price and taxation measures, including excise duties. This is not something that depends on health ministers alone. Reducing alcohol abuse is something that all ministers, all parliaments, regions and municipalities need to be engaged in. I will be encouraging health ministers to talk to other ministers, in particular their finance and taxation counterparts, and get them to defend public health concerns when revising EU law on these matters. My message to the health ministers will be, we need to work at all levels and in all sectors to be successful. The EU alone cannot raise national taxes on alcohol, nor increase the legal age to drink, nor regulate where and under which conditions alcohol is sold, nor impose zero tolerance to alcohol in road safety. This has been done at national and regional level. A recent court case in Scotland shows that public health concerns can prevail over economic concerns, and that it is up to member states to determine the best measures to protect citizens' health from alcohol, including minimum pricing. But that doesn't mean I am washing my hands of the issue. No. On the contrary, the EU has a strategy on alcohol and health which is still valid. Such old strategy is still valid. And we are actively pursuing it. I'm strategically engaged in supporting member states in addressing alcohol in every way I can, including exchange of best practice, concrete projects, and a dedicated budget from the health program to support national efforts on alcohol. Tomorrow, I will also be pleased to share the latest development in our fight against antimicrobial resistance, which has become a real threat to our health, our economies, as well as the sustainability of our food production. As you know, we launched the new European One Health Action Plan against AMR just this past June. The second such plan launched in the EU. This new action plan reinforces ongoing measures and introduces new One Health actions to help us coordinate efforts in human and animal health as well as environmental sector. The new action plan focuses on three main priorities. Our first priority is to firmly establish the EU as a recognized best practice region in the field of AMR. That means that with this coordinated approach, the Commission plans to raise the level of protection against AMR in the EU to highest in the world. Secondly, our priority is to boost innovation and research. The Commission will continue to invest under Horizon 2020 into medical innovations to help tackle AMR. And third priority is to strengthen the EU presence and influence in the international arena with the World Health Organization Global Action Plan as a blueprint for international actions, and by reinforcing engagement and collaboration with other organizations on this pressing issue. The EU is already one of the leaders in this area, and the Commission hopes that all member states will adopt their own health action plans by 2017. We must promote our EU standards for combating AMR with our trade partners. And I congratulate you and those member states that have already done so. Thank you.
Thank you, Commissioner. We will now move on to questions. Please introduce yourself and the media you represent, and please also indicate whether your question is to the Minister, to the Commissioner, or both.
Hi, my name is Anette Parksepp and I'm from Estonian Public Broadcasting. And my question is to Minister Ossinovski and it concerns Estonian e-health system. Estonian example has shown that medical institutions are quite reluctant to cooperate even within Estonia. And while they have an obligation to upload information, there are still some issues with sharing the information. For example, not all necessary information is being uploaded into the system, so doctors often cannot see the previous lab results and medication that the patient has been using. And the system is currently more of a storage of files that cannot be statistically implemented, and doctors don't have the time to go through all the information. So how are you currently addressing these issues in the Estonian e-health system, and when can we expect a more structured digital story, for example?
Thank you very much. Firstly, of course, there are huge challenges with our health information system that we're addressing quite aggressively, I would say, but of course it all takes time. But in a wider European context, our system is actually quite unique, in a sense that we have basically a 10 years of track record of obligation of all medical practitioners to enter all health data information in one unified database. We just heard today at the session of a Dutch example where the parliament, for example, didn't allow the state to have that kind of information system at all, and many other countries still lack it. So actually, if you look at this amount of information that there is, I think our biggest challenge, and not only ours, but generally in many countries, is that there are vast amounts of information available, but we're not very good at actually putting it to good use. So it's a rather question of data analytics and linking this information to technology that can be implemented then on the ground. So it's in the end it's a sort of three-way challenge. First, you have to have a unified structure of data, and we're working on the new protocols or on the semantics, which were again mentioned today at the session, that we actually should be moving towards a more unified European approach to health data semantics, so that they could be used not only within member states more efficiently, but actually across borders in the European context. So data protocols and semantics, clearly the first one as a sort of foundation for the real implementation. Secondly, it's the technology, data analytics and technology, that then is able to do something useful with this data. And third is the implementation on the ground. And of course, there are challenges with all of those, and as was mentioned again today by the head of the e-health network, Dr. Auer, the biggest challenge remains in Europe the attitude of practitioners, the attitudes of doctors towards e-health solutions. In most countries, including ours, I have to say, when you say that there are new opportunities, capabilities of the e-health to actually make the health system more efficient and provide more personalized care, most doctors would say, just give us more money and we'll be fine. And that's unfortunately the case in most countries, and we were discussing, for example, how to implement digital skills for doctors in their curriculums in the universities, so that they would actually be taught how to use data for the better use of their patients, which we haven't done systematically up until now. So it's not only the question of better protocols, better semantics, which is also a challenge, but a much wider set of problems that we need to address at the same time. And we're doing that based on in Estonia here, we are doing it based on our approved strategy for e-health development. So we're moving forward quickly. Of course, the progress has not been, even here, has not been as quick as we would wish. But if we look at some other member states, then I would say that in general, as a continent, as a union, we have not been ambitious and quick enough in implementing the technologies that are available there for the benefits of our citizens. Thank you.
If I may, I fully agree with what just was said, because it's not only an Estonian problem. In all member states, we have a lot of problems speaking about possibilities to encourage healthcare sectors to cooperate, to guarantee interoperability, and so on and so on. Why we are drawing attention on such public consultations today? It's very important to receive a lot of different proposals and so on, and to see how then to move together. And of course, I count especially on European Reference Network, which helps to motivate medical professionals, patients to cooperate and to overcome silo mentality. Because today, silo mentality is the main challenge.
We have time for one more question. Or maybe no. Thank you to the speakers for being so comprehensive and convincing that nothing remains unclear. And thank you all for coming. And this concludes our press conference today.
Thank you so much.
Thank you.